Hi, my name is Phil Borders. I'm a psychiatrist at Hendricks Therapy here in central Indiana, and I've decided to wear this cardigan sweater every day for the rest of my life. So today we're here to talk about ketamine, how we use it here at Hendricks Therapy. We're also here to talk about, get excited, we're talking about molecules and routes of administration. So, speaking of ketamine and how we do it at Hendricks Therapy, we do ketamine a little bit differently than most. We have decided to do the intramuscular route of ketamine, where you get a shot in your deltoid. So we do that for a couple of reasons. One is we can do it for basically half the cost of the intravenous ketamine. And we also do it because it's 93% bioavailable. So before we go further, we probably need to talk about what is bioavailability. So bioavailability is simply the amount of medication that gets in your bloodstream. So one of the reasons why you don't see a whole lot of oral ketamine out there, or at least in doctors' offices or in clinics, is because it doesn't get absorbed very well. So it doesn't get absorbed very well, and it also gets broken down by your liver. So what livers do is they break apart things. So the amount of ketamine that you take orally, only a fraction of it gets into your bloodstream to actually do anything. So they've come up with other routes of administration. One is intranasal. So basically you inhale it, gets into your lungs, which then gets into your bloodstream. And that is what Spravato is. Spravato is a molecule that was FDA approved for depression in 2019. So the makers of Spravato, what they did, and this is where we have to kind of learn a little bit about chemistry, is each molecule has a certain chemical formula. Like water is H2O, 2 hydrogen atoms and an oxygen atom. Now, every organic molecule, organic means carbon-based, has different structures. Same molecular formula, but different structures. So ketamine has two structures. It has a left-handed molecule and a right-handed molecule. Now, each of these molecules are, they have the same formula, but they're structurally different. They're mirror images of each other. So what the makers of Spravato did, they got rid of the right molecule, keeping the left, and they had it FDA approved and they patented it. So since 2019, Spravato's been out there, and it's a very good medication. It's great for treatment-resistant depression. The data behind it is very good. However, the negative things about Spravato are that it's very expensive. It's thousands of dollars per month. It's about 30 to 50% bioavailable, so maybe not as great as far as the amount of medication that gets in your bloodstream to have a positive effect. And also, it's really costly to the healthcare system. The positives of Spravato are FDA approved, and that means a lot to a lot of patients. And there's no needles. And if your insurance pays for it, it can be affordable. So I've used it. I'm not going to badmouth it. I'm certainly not going to badmouth pharmaceutical companies because they spend a lot of money to get things approved, and they've contributed a lot to medical science. IV ketamine has its pluses and minuses. IV meaning intravenous. So the pluses are it's 100% in your vein, 100% bioavailable. The negatives to the IV is that's just really expensive. It's up to like $600 per treatment, and that is not covered by your insurance company. So it has a lot of data behind it. A lot of studies have shown that IV ketamine is very effective and is more effective than intranasal ketamine or Spravato. So pluses and minuses of IV. Intramuscular ketamine, and that's what we've decided to use, has its pluses and minuses. It is 93% bioavailable. So if you get an intramuscular injection in the deltoid, it's about 93% of it is going to be in your bloodstream. 93 and 100%, pretty close. And if you look at studies between the intramuscular and the intravenous ketamine, they're pretty close as far as their efficacy, if not the same. The downside to it, it's a needle. It probably hits you a little bit harder than the IV ketamine. So if you have a trip, it's going to be probably a little more intense. Probably the nausea is a little bit worse. So the intramuscular ketamine is effective and it's affordable. It's also what we do, I think, is provides an extra layer of safety. Now, a friend of mine, she's a pulmonologist. Her name's Maria, and she works in acute care settings, and she absolutely loves ketamine. She talks about it all the time. I'm assuming she's talking about using it medicinally. I don't know if she uses it recreationally. Maria's a little bit edgy, but I'm pretty sure she's talking about just clinical settings. So she loves ketamine because it's safe. And we try to make our treatment very safe also. So we monitor your heart rate, your blood pressure, your oxygen level, and we also measure your trip. And having a trip sometimes happens, sometimes it doesn't happen, but we make sure that you're not discharged until you're not having a trip. So we keep a good eye on that. So we have safety, we have affordability, we have efficacy. But what we do differently also is that we have ketamine therapy and not just a ketamine shot. So during this time, during these weeks that you're receiving ketamine therapy, your brain is like a sponge. Your brain is highly adaptable, highly malleable, so it can learn new positive habits. So we, number one, have to make sure that you're in a safe environment because we don't want negative habits to happen. So it can't, someone can't be like in an abusive relationship. But we have people, if they're in a safe environment, if they're in a safe place in their life, we have them focus on basic things to help them get better. These are not to replace therapy or medication, but basic things like exercise. Basic things like reaching out to others and increasing their connections. Positive affirmations. They seem incredibly cheesy, but study after study has shown that positive affirmations actually work and help. So they do positive affirmations. We want them to look at nutrition videos. If you're eating a highly processed diet, it's not good for your brain. And also just simple things like having fun. People sometimes don't think about just having fun to help with depression. It does a couple things. Number one, it's the right thing to do. Number two, symbolically, it helps patients understand that they are valuable enough to take care of. So we emphasize therapy in addition to just receiving a shot and trying to turn old habits, bad habits into new positive habits and helping the brain get rewired. So one of our criteria is we expect patients to have skin in the game. And our thinking is if you're going to take this time and money to invest in yourself, you know what, let's not waste it. This is a time where your brain is a sponge and we're going to do as much as possible as we can to help create a brain that is doing well and that will continue to do well even once the ketamine therapy is stopped. So our goal is affordability. We're also trying to make it convenient. If you get a ride to our office, we're going to Uber you home up to $30. So you don't have to have somebody wait around for you if you don't want to. It's safe, it's effective, and we're hoping that it's going to be a game changer for you or someone you love. So thanks again for listening, and this is the end of our Ketamine series. Look us up if you have a chance, if you need us, and thanks again. Bye.